Casey. My name is Sarah. I'm the nurse taking care of you today. Can you state your name and date of birth for me, please? And we have Casey Banks, 10/2/1965. Casey Banks, 10/2/65. And do you have any allergies, Casey? Casey says he's allergic to aspirin, and I see that on the wristband and on the medication record. Okay, Casey, so the reason why I am here today is because I heard that you were having some pain. Is that correct? And Casey says yes, he's been having some pain. Can you rate that on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain you ever had? And Casey says it's about a 7 out of 10. He says that his back is just hurting him pretty bad right now. All right, Casey, I did bring some ibuprofen with me. Have you ever had that before? And Casey says nope, he's never had that. All right, so this is a non-steroidal anti-inflammatory drug. It should help with your pain. It usually takes about an hour for this to start kicking in. But I will come back at that hour mark just to see if your pain has improved, okay? And Casey says, all right. So before we get started, I'm going to do my third MAR check, and then we're going to do a couple of assessments, all right? Casey says, okay. So today we have Casey Banks, 10/2/1965, allergy to aspirin. And today we have an order for ibuprofen. I had my ibuprofen here per feeding tube. We did crush that with 20 mLs of water, which we have right there. BID, dose of 200 milligrams. This was 200 milligrams at 0900. It has not been given today. It's not expired, and it does not contain aspirin. So MAR check 3 is complete. I'm just going to give this another stir because it did settle a bit. So again, I'm not using the cotton tip end. I'm going to use the wooden or the plastic end just to stir this back up so he gets all his medication. All right, so we have that. Casey, I'm going to sit you up a little bit. All right, so we're putting the patient in the high Fowler's position. This is to help prevent aspiration of the medication. There we go. I'm just gonna help get you situated. There. All right, so we assessed your pain. I'm just gonna take a listen to your bowel sounds and palpate for any tenderness at this time. Okay, so I'm going to take a listen here. Okay, bowel sounds are active. Does this hurt at all if I press here on your belly? And Casey says, no, that does not hurt at all. It's just his back that's bothering him. All right, so at this point, we would also measure for abdominal distension. So you're going to do the abdominal girth at the level of the umbilicus or the belly button. Okay, so we measured that. Good. I'm just going to grab my gloves, Casey. Okay, so set our gloves here. Doing my hand hygiene again. I'm going to get my flushes set up. So I'm going to put 30 mLs of water, which we already checked our package integrity and expiration dates in the med room. And I'm going to put 30 mLs in this cup for my pre-medication flush. And then 30 mLs in my post-medication flush. And always measuring at eye level. There we go. Those are ready. Okay, I'm just going to do my hand hygiene again, and I'm going to get my gloves on. Here we go. I'm going to bring this washcloth closer in case there's any dribbles that happen to come out here. So we are going to check placement of our tube. So what we're going to do is take a sample of the gastric fluid and test it with some litmus paper. So I'm going to clamp the tube with my finger here and going to remove the stopper. So I'm using the feeding port which is the one that's straight in line with the rest of the tube, not the one that angles off to the side. And I'm going to alcohol this off. And I'm going to alcohol this little adapter peg too, 10 to 15 seconds. Okay, putting the adapter in. I'm still clamped, and I'm going to take my 60 ml syringe and attach it like this. Once it's attached, I release my hold so that it's not clamped. I'm going to aspirate 5 to 10 mLs of gastric fluid. And this is going to help tell me the location of the tube and make sure I'm in the correct place before I start putting more contents through the tube. So before I remove the syringe, I'm pinching the tube. I'm going to pour this into my leftover cup here, and I'm just setting my syringe aside. So I'm going to alcohol my tube off again. Now it's shut, so I can let go of this. So I'm going to take my litmus paper and we're going to test our secretions here. All right, so we'll say that I do my first test and I have an 8. That would mean I am in the intestine, so I wouldn't want that. So we may have to adjust the tube. Okay, using this one. And I'm gonna say I get a 6. That would indicate that I'm in the lungs. And last, I have a 4, which means I'm in the stomach. That's exactly where I wanna be. So I'm gonna set this aside, set my gastric secretions aside, and now we're going to begin with the medication administration. So Casey, I'm gonna be putting a flush down your tube. You shouldn't really feel it at all. So we're gonna flush with some water. We'll put the medication down your tube, and then we're going to flush with water again. And like I said, I'll come back in about an hour to reassess your pain. Does that sound okay? Casey says, yes, that sounds all right. So I have the tube here. I'm gonna clean off the medication port. So that's the one that angles off to the side here. So I'm clamping this. But first I'm going to separate my syringe. So you have a slip tip syringe. You're gonna take the plunger out so it looks just like this. So clamping the tube, removing the plunger or the stopper. I'm gonna alcohol this off for 10 to 15 seconds. It's still clamped. I'm going to attach my syringe here. Okay. So I have that connected. I'm going to give